Our mission is the same mission that was established 40 years ago at Mount Zion Hospital. How do we keep older adults out of nursing homes and out of hospitals whenever possible? Many people end up in nursing homes that don't need to be there because they don't have the social support system to keep them in the community.
The last of 6 children in Ravenscar, England. My husband, we met in St. John's Presbyterian Church, and he was very handsome. I couldn't find a better man in the whole world if I searched it round 10 times.
With my dad's passing, her whole life changed. When I first noticed that she was having memory issues, that all over the house she had notes for herself. She also had a whole list of all her children and their birth dates so that she wouldn't forget. I personally went and looked at a lot of different programs, and Institute on Aging's work has allowed my mother a great quality of life and has given her independence to retain her dignity and to pursue life still as a senior.
It's often said the worst thing to be in America today is to be old. And that's one of the things that Institute on Aging is really wanting to change those attitudes and perceptions of how society looks at older people, because all of us are going to be old.
There is no other organization in this country that is like Institute on Aging. What we do best is help manage the care of people in the community, loved ones in the community. And we do that in multiple ways. We do that through our home care program where we provide hands-on care. We do creative things. We have an art program that we provide in our day centers because we know that older adults are looking for ways to express themselves. So we find that art and poetry and other mediums are avenues for them to express their creativity. We run a medical program for frail adults who need medical intervention, individuals who would be nursing home eligible. We're able to provide them medical care and social support systems that allow them to remain in the community rather than ending up in a nursing home.
I was diagnosed on March 2011 with Parkinson's. Parkinson's is a pain, a very bad pain in my muscles and joints. It's so painful that I cannot get up. I can't comb my hair, I can't brush my teeth. I was not able to walk. I didn't think there was any hope in my recovery. I came to Institute on Aging with the help of my primary doctor who referred me to the Institute. There's the clinic, there's the lunch every day when I come in, then I go to rehab to get my therapy. It's a place where I come that everything's here, a one-stop place.
It's very easy for people to slip through the cracks, and so that's something that Institute on Aging, through all of its programs, is really recognize the value and worth of that individual.
Hi Keith, it's Michelle at the Friendship Line.
The Friendship Line is an accredited crisis intervention suicide prevention program, and it's the only program of its kind in the country that targets older adults who may be at risk of suicide, may be at risk for depression, isolation, and loneliness.
No, absolutely. I'm glad you called.
They can call us, once a day, every day, or we'll call out to them, particularly those who are really wanting to remain independent, and yet just don't have anybody in their life to support them emotionally.
One of the challenges for families and caregivers is to try to figure out what is it that the Institute on Aging can do to help them. So we created a program called Institute on Aging Connect, one place for families and caregivers to call, and we help them sort out what it is they need. Not just services provided here by the Institute, but services offered throughout this community. The majority of the people that we serve are poor, but there is a small segment of people who are able to pay for our services, and they choose us because of our exceptional quality, and we're able to use that revenue to help support our charitable work.
It's kind of funny because I've been on the board for 10, 12 years, and all of a sudden I became a client. I had some medical problems earlier this year, and when I left the hospital, they ordered home care for me. The Institute on Aging allowed me to be at home during my recovery period rather than go to a convalescent hospital, which really did not appeal to me, and I think it's sped up my recovery. Look, I'm fully recovered.
No one chooses to go to a nursing home. No one. As a community, we have a responsibility to take care of our elders. Often their needs go unseen, but their needs are very real. We need to give back to those who gave to us. So I turn to the community for support. I don't want to be in a position to have to turn people away. And with support, I won't need to do that. In fact, we'll be able to continue to find innovative solutions.
There are so many good causes out there, but you have to put your money where they'll do some good and where you can really see a change. And all you have to do is see what goes on at the Institute on Aging, and you know that you're changing the lives of these people for the better.
My mom feels connection to the center, and they feel connected to her. It's not where it's just a business, but it becomes an extended family.
There is hope here. We just have to ask people to help us.
By opening our hearts, opening our wallets to the needs of older people, what we're saying is that if I can help this group of people age in a healthier way, with quality of life, what that means is that then I am creating kind of a pathway for my own aging, that maybe somebody will be there for me because we've laid the groundwork. But we can't do it without everyone's help.
Whether it's crisis intervention, social isolation, prevention of elder abuse, hands-on care, or caregiver support systems, that all revolves around the sole mission of keeping somebody living independently with dignity at home.
This has allowed me to have the goal of preserving my mom's lifestyle and her dignity and her freedom. I can still work, I can still deal with my kids, and she's not in a facility where she is just there 24 hours in a hospital setting. We know she's getting the best care, and we also know that she enjoys it.